The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, interventional cardiologist Dr. Annie Varghese discusses the signs and symptoms for severe carotid stenosis. Facial plastic surgeon Dr. Yadro Duchik helps his patient improve her appearance and quality of life with a facelift. Minimally invasive spine surgeon Dr. Douglas Wan talks about his approach to spine care. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Miss Richardson, wonderful woman, very busy, and she was just dizzy, and she wanted to be checked out. And we did our routine screenings of our patients where we check the heart with ultrasound, the carotids, ultrasound, aorta, legs, all of those things. But what we found was large plaque in the carotid, large plaque, and with a very abnormal velocity or blood flow.
But she sent me to have an MRI, and they found something, and so they sent me to a neurologist who ran tests and finally sent me to have a CAT scan and found out that my carotid artery was blocked. So she sent me to St. Luke's to a Dr. Krager who put a stent in.
People will have dizziness. Sometimes there are no symptoms. So silence is not golden here. Silence is deadly. So that's why it's so important to be checked. In the literature, of course, we know that the older we are, the more oxidative stress, the more plaque formation occurs in the vessels. But I have found young people to have already atherosclerosis or plaque formation. So if we can find it at a younger age, in their 20s and 30s, that they're developing plaque, we can protect them from presenting like Ms. Richardson did, you know, with a severe blockage that could only be fixed by surgery.
She's very personable. She has plenty of time to talk to you and tell you what the symptoms are and what can be done, and she's very caring.
Carotid disease can also present with symptoms of numbness or tingling, difficulty speaking, changes in the facial shape. Basically, people may not be able to smile, or maybe they've had small strokes where they can't move their face or speak or move their arms or legs like they used to. So those things should be checked even if they're subtle. You should check with their doctor.
When you find a doctor that you can recommend to your friends and to your family, it's great. I'm not a big fan of doctors, but I just love her to death.
Taking a multivitamin is a quick and easy way to make sure you're consuming the essential vitamins and minerals you may not be getting from food. Make sure your supplement delivers 400 IU of vitamin D, which is the dose that is said to reduce risk of early death by 7%.
Well, we are from Bolivia. I came 2.5 years ago. My father and my mother, they started to seeing something strange with my baby girl.
I think the very first time that I noticed, and I was the one that really noticed it, there may be an issue, was when I first held her in Bolivia. She was just a few weeks old. I just noted that she didn't appear to be responding to noise and sounds around.
I was thinking that she was okay, that nothing was wrong. Maybe she's distracting, I don't know. When they told us that she wasn't listening, it was hard because I want she can listen to me or she can listen herself. So sometimes it's frustrating that you talk to the baby or you want to teach her something and you can, she cannot listen.
Well, we first contacted Dr. Peters in Dallas Hearing Institute. Then we knew that he was the president of the foundation, of Dallas Hearing Foundation. And we talked to him, and they started looking for a device for Mia. And I'm glad that they found the right one. And hopefully, and it got help, that's gonna work good. It's gonna work good.
Med-El, along with the Dallas Hearing Foundation, we share a commitment to the hearing loss community. And when the Dallas Hearing Foundation approached Med-El, we thought this was an ideal situation to kind of help out a family. And so we put them into our grant process. And as the patient goes through the grant process, you know, me and her family were.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
It's important to first determine that if they're an appropriate candidate for a facelift or not. The general principle is you have to have enough looseness of skin and redundant skin to be a good candidate for facelift. If you don't have enough looseness of skin or laxity, it just won't work very well. You have to preserve the central third of the face, so this oval, if you will, because that's really what defines us as uniquely individual.
I am getting older, and teaching is my third career. And what I observed was the older looking teachers were losing their jobs. And I just wanted to look as young as I could. I had tried a variety of other things, other procedures, and I finally decided to just go for it and go to Dr. Duchik and get everything fixed up. I was impressed by his place of business, as well as his people were all very friendly and helpful, and they just made me feel comfortable. It was overall positive experience, and I felt like he really knew what he was doing.
We have so many minimally invasive techniques available today that really have very little downtime, have excellent results, and make you look more youthful and fresher, because that's the whole point of everything. It's the point to look better. And however we can accomplish that, that's easiest on the patient, that's what we want to do.
I don't think he does things that don't need to be done. So he doesn't push more than you would need, whether that be shots or surgery or whatever. He does what he thinks is going to give you the best result. I definitely am glad I had this done. Most people have no idea how old I am, so I feel pretty good about that. Nobody's tried to fire me for being too old to teach, so I feel pretty good about that. And I'm very happy with the results, very happy.
Find your doctor on bestdocsnetwork.com.
Terry has a question for Dr. Wade Barker. Will I have excess skin after bariatric surgery?
Many patients ask about whether they'll have excess skin or not after bariatric surgery. It's highly variable. Some patients do and some patients don't. It's related to age, to skin type, what kind of skin you got from your parents, and sun exposure, and smoking. Smokers don't have very elastic skin, and so they may have excess skin. Also depends on the preoperative body shape, and obviously if you have a very large pannus to start with, it's not really going to go anywhere. But we do have board certified plastic surgeons that are in the office with us every week. They talk to the patients, and they're very eager to help with insurance and get those things taken care of. We usually recommend that you wait a year and a half prior to having that done. But I think it's important also to have it done by a plastic surgeon who is board certified and been fully trained to do those things. They can be fairly large procedures if there's a large pannus left, and they're not something to be taken lightly.
Ask our doctors on bestdocsnetwork.com.
Eating eggs for breakfast not only tastes good, but they help to slim you down. Each egg you eat has 6 grams of protein, but only 72 calories.
And we welcome you inside the Best Docs Network studio. We are happy to be joined by Dr. Doug Wan. And when it comes to spine and neck surgery, this is your go-to doctor. He is also the director and founder of Spine Care. Dr. Wan, welcome to the program.
Thank you. Thank you for having me.
Let's start it off with your philosophy when it comes to your approach to medicine. What would that be?
So we practice medicine based on, our approach is very patient-centric, providing the best care for the patient. And when it comes to spine care, spine problems are a very complex issue. And so our approach is to approach it with a very comprehensive approach. So in our center, we have from the least invasive way to the most complex way of treating spine conditions. And we have providers such as chiropractors, physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeons. And we approach it through a multidisciplinary approach and find the best way to treat the patients so that they get the most amount of pain relief.
All right, doctor, what was your goal in creating Spine Care? What did you have in mind?
When we created Spine Care, our goal is to provide the best kind of spine care to the patients. There are many patients with a very complex spine problems. However, not everyone may need spine surgery, so we approach the spine through a multidisciplinary approach, and we find the best way to treat the patients with significant back pain. That's why we have from the chiropractor to physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeon. We find the right diagnosis and treat the patient the right way and the least invasive way possible so that they can get their life back as soon as possible. Also at the Spine Care, we have high-level imaging so that patients do not have to travel elsewhere to get their imaging studies done. Also, we have our own procedure centers on campus, so therefore they can not only get the evaluation, but also pain procedures done, as well as spine surgery.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. The fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, clinical psychologist Dr. Collins Hodges discusses how he is able to help families adapt to life changes. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Vein specialist Dr. Peter Morgan talks about varicose veins. Craniofacial and plastic surgeon Dr. David Jenikov talks about his approach to facial rejuvenation with his patients, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
My son was going through a transition of graduating from high school and entering a new chapter in his life. And so I think there was some anxiety on his part. There was some anxiety on my part. It was coming out in negative ways, and we had to identify what's going on. And we needed somebody, an outside person, to kind of help us mediate and facilitate through some of the feelings that were going on.
Alma and Quattro were great. I really enjoyed working with them. They were both very sweet, very bright, very interested in working in therapy. They initially came to see me because Quattro was moving along in his development. He was moving into young adulthood, moving off into college, and part of the conflict there was, what does his move into college and his developmental move into young adulthood mean in terms of the renegotiation of boundaries between mom and son, and then the renegotiation of roles between mom and son.
Dr. Hodges provided a great environment. He's a facilitator and a mediator, and that's what me and my mom needed in our relationship at the time.
The main change that I saw was a better understanding from each of them as to what their new role was going to be. They both came to a better understanding as to who they were, not only as individuals, but as a close mother and child.
Dr. Hodges gave us some really good guidance and encouragement, and through love and trust, we were able to get through some tough spots and have some success.
After seeing Dr. Hodges, it is just gave me and my mom a greater respect for each other as individuals, and just has taught us to learn and grow with each other. Dr. Hodges has helped me realize what progress is and how to obtain it.
Request an appointment on bestdocsnetwork.com.
Your doctor may want you to have a stress test. This is to check on your heart, to see how it's doing when your heart is under stress. For example, you run on a treadmill that gradually raises an incline, and that puts you into a hyperactive mode so that your heart's beating fast, and that makes your blood flow in your heart need to be optimum. Now, if your blood flow in your heart is not good, you're having blockages with plaque, then that will show up on your EKG while you're running on that upward slope and getting your pulse rate up. There are different kinds of stress tests. There's just a plain old stress test where you run. Stress test machine.
For numerous years I've had varicose veins. I'm a registered nurse, and so I have been on my feet for 20 years, and also heredity has played into that. And so just a lot of varicosities and some pain, aching if I've been standing on my feet for a long period of time, and then just unsightliness.
Varicose veins are a symptom. They're a sign of an underlying disease or abnormality in the venous circulation. In your legs, there is no heart to pump the used blood back up, and so the pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point. You know exactly what he could do for me, and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
Patrick has a question for Dr. Sarah Suttle. I have a ball and foot pain. What is it, and what are my treatment options?
Typically, ball and foot pain can be caused by a neuroma, which is an entrapped nerve in between two of the long bones in the foot. There's several things you can do for it. The most conservative thing being just pads in your shoes to help offload that nerve when you do stand down. A little bit more aggressive would be a series of steroid injections. If those fail, there are things called alcohol sclerosing injections, which go directly into the neuroma. Sounds like torture, but it's not. It's alcohol sclerosing injections that go directly into the neuroma, and it shrinks and kills the neuroma. The most common cause of ball and foot pain would be a neuroma, but it's very important to get an examination and some x-rays by your foot and ankle specialist just to make sure that there's not anything more serious going on that requires different treatment.
Ask our doctors on bestdocsnetwork.com.
To avoid your child being poisoned, be sure to store all medicines and household products up, away, and out of sight in a cabinet out of their reach. Poison Control reported 9 out of 10 poisonings in children occur in your home.
And we are excited to have in the Best Docs Network studio Dr. David Gennikov. He is the owner and director of the Gennikov Plastic Surgery Group, one of the best plastic surgeons in the state of Texas, and operates right here in the Dallas-Fort Worth area. Dr. Gennikov, welcome to the program.
Thank you, Jim.
All right, let's get right to it. You know, if I come into your place, anyone else come into your place, they want to look younger. There's no doubt about it. So if you're consulting with an individual and they come in and say, hey, I want cosmetic facial plastic surgery, what do you do?
Well, anybody that comes to the office is really kind of unhappy with something about themselves. And usually when they come in with an issue about their face, we get comments like, I now have my grandmother's neck, or, you know, I look just like my dad, or I'm out there trying to get a job and I'm competing with people that are 20 years younger than me and I look 30 years older than them. How do I get back to a more competitive position? And so we start to talk to them. I talk to them about what their goals are. And so sometimes they think they just want surgery, when in actuality, they don't really need surgery at all. They could use some non-surgical treatments with injections or fillers, or even some skin therapy. And those kinds of things will highlight some of the patients just enough so it'll get them where they need to go. Additionally, if they do need surgery, we do a full physical examination and really try to find out what it is that is bothering them. And so it's that detailed conversation with the patient at the very beginning that helps guide what kind of treatment that they're going to get.
Okay, now for an individual that comes into your practice and says, I just want to look better, what do you tell them?
Well, I have them look in the mirror. And that's where it all starts. We put them in front of a mirror and say, what is it that you see that you'd like to change? And so we address the eyes and the nose, the area around the mouth, and the jowl and the neck, and we look at each one of those. And then I begin to kind of move things around for them and show them what it looks like, what the options can be.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
If you can work up a sweat for just 1 hour a week, you can reduce your risk of heart attack, improve overall mood, and lower blood pressure.
Watch more videos on bestdocsnetwork.com.
Before I had the surgery, my life was not very active. I was always trying the next new thing or the next miracle, drug or diet pill, and it was, just one of those things. Life was tiring, life wasn't terribly enjoyable, and I wasn't able to do a whole lot because everything just required a lot of effort. Wanted to have children, didn't really feel like that was going to be a possibility in the body that I had, and so although I wanted children, I didn't really feel like it was a viable option because of the weight that I was at.
We have several procedures that are successful for weight loss. All of them work. All of them are successful if the patient does what we ask them to do. The procedures we pick for each patient depends a lot on the patient. Some patients are very motivated towards diet and exercise, and maybe we can do a little bit of a less procedure for those patients. Patients that, in my mind, do not seem to be motivated, and we might pick a little bit more of a drastic procedure for their obesity.
The reason that I chose the lap band is that I felt like it was a less invasive procedure. I really didn't want to have a procedure that would completely take portions of my body out or portions of my intestines. It was an addition to what was already there, and in the event that it wasn't something I wanted anymore, it was something that could be removed and taken out. In the first 3 weeks, I lost a little over 25 pounds, which was a first huge victory for me. And so while my weight loss was over a 2-year period to actually get to the goal where I wanted to be, after just a few months, I was able to already be more active and have a better outlook on life and begin to see that things were going to come to fruition that I had wanted for so long.
I think the most important change we can make in a patient is self-esteem. We see so many patients that are depressed because of their weight. They try to be successful in their weight loss and have not been successful, and they're just kind of down on themselves.
Thanks to Dr. Carter, I have my life, and I'm able to be a mom and to be the best person that I can be. I just feel like I have my life back because of Dr. Carter.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.